Well, it is absolutely normal for people to have concerns and develop psychological stress and side effects due to these unprecedented times that we're all experiencing. People might be worried about their loved ones, about themselves perhaps becoming ill, whether they're looking after some elderly people they're concerned about, children. People might be also concerned about the potential loss of income, as well as potential loss of business opportunities for them, and have a sense that this is going to last for some time. Now, all of these concerns can cause psychological stress, and that includes for some people insomnia, some might feel anger, perhaps a fear, grief, a sense of sadness, and even irritability. And in particular, if you are a healthcare worker, you might also experience signs of acute stress, including exhaustion, anxiety in dealing with patients, poor concentration, and even reluctance to go to work.
There's a lot of uncertainty at the moment. Plans changed or even cancelled, routine out the window. So how can one deal with the anxiety that comes with that uncertainty that we're experiencing at the moment?
Well, these are really unprecedented times, and the situation itself of lockdown generates a fair deal of anxiety. Well, I see two types of responses that people might have during situations like this. One is what I call the rejection of reality, and the second reaction is what I call the acceptance of reality. The rejection of reality is a primitive position that we all can experience, where the mind reacts with two types of defenses. One that is rooted in denial and omnipotence, and the second one instead involves panic, exaggeration, and helplessness. When we are in denial, we might stop following instruction to stay at home, or we start believing that we're immune to all of this and we go out. On the contrary, when we over-panic over things and exaggerate over the situation, we might not feel that we are in control and start feeling helpless and perhaps feeling despair. Now, the opposite of this response is acceptance of reality, where we recognize our vulnerability and danger, but we also feel anchored and grounded, accepting the responsibility for whatever we can control in all of this. Now, this response also comes with a fair deal of anxiety and pain, but it is not the quality of despair, and instead we accept that we can do our best and take responsibility to face reality. Now, the good news is that people can shift and move their response from denial to accepting reality. And there are things that people can do. First of all, it's important that you stay in touch with friends and family. Even if you can't see them in person, you can have a video and a phone call with them. Engage in physical activity. It's so important for your body. Also maintain a routine as much as you can. Plan regular activities that help you feel good. And avoid using, unhelpful coping strategies like smoking, alcohol, or taking drugs. Try to limit the time you spend watching, reading, or listening to the news. And spend time deliberately engaging with tasks that take your mind away from the current crisis. If you feel overwhelmed, know that there are ways to get support, perhaps with a therapist online. Be compassionate to yourself and others, and it is okay to say that you're not okay. Focus on what it is on your control and pay attention to things that are going well when you can. And remember, this situation is not here to stay forever.
At the moment, we're constantly being bombarded by news left, right and centre. So how important is it that we strike the right balance between staying informed but also not being overwhelmed by this constant information that we're receiving?
So it is really important for our well-being to have news, but not to feel overwhelmed by them. So the recommendation here is that to possibly look at the news in the morning or in the evenings. And it is important that you only connect to reliable media sources such as GBC, BBC, perhaps Sky News or Euronews. Now limit it to a specific time of the day and make sure that you switch off all those notifications from news apps that you might get on your phone, because they're random and can easily interrupt whatever routine and structure you have built around yourself and your day. And it creates worries.
Loneliness is a big issue for many who are now facing weeks, if not months, of very little human contact. So what advice would you give them, to those people who are living in that scenario right now?
Well, we are social beings, and being isolated is a big deal for us all. I believe most people can probably manage 1 to 2 weeks of isolation, and after that might start finding it difficult. These are 4 things I would like to recommend for people to focus on to overcome loneliness. The most obvious one is to stay connected socially through other means, such as online platform or apps that allows you to communicate and video conferencing with family and friends. Another thing, it is very important to help you coping with isolation if you keep remembering why this is happening. In many ways, this is a form of altruism, and it is not just for our own safety and benefit, it's also for the benefit of others, because we're all helping the whole community and the GHA, which we do not want to see struggling. That's why we're all doing it, so keep remembering that. Also, it's important that you do get your amount of information and connect to reliable sources, but just don't overdo over that. And again, sleeping well, eating well, exercise, all gives you a sense of structure and routine, which is really, really important. Finally, remember to be kind, as this is a difficult time, but we will get through this, and sooner we will be on the other side of it.